Menstrual disorders are serious health problems that impact the daily lives of 1 in 4 women. Menstrual disorders such as PCOS and endometriosis cause a variety of symptoms spanning from menstrual irregularities to infertility. Researchers are looking at menstrual effluent as a potential tool for early detection of these diseases. Our Capstone project, sponsored by Dr. Pan, designed a smart sanitary pad that detects a biomarker commonly found in the menstrual effluent of endometriosis patients. Endometriosis is a painful condition where tissue that is similar to the inner lining of the uterus grows outside the uterus. It can affect the ovaries, fallopian tubes, and the tissue lining of the pelvis. The disease impacts the lives of 1 in 10 women. However, surgical studies show that only 5.4% of these cases are properly diagnosed. The gold standard for diagnosing endometriosis is exploratory laparoscopic surgery, where a surgeon will visualize and excise endometrial growths. Unfortunately, this surgery is invasive and is not risk averse. Women on average spend 7 to 10 years seeking a diagnosis for their symptoms. There is a critical need to design tools that close the gap in the time that it takes to diagnose menstrual disorders. The goal of our pad is to create a private, at home diagnostic tool that women can use to advocate for an endometriosis diagnosis if they detect endometriosis biomarkers in their menstrual blood. Our prototype design includes 4 major components. These are the sanitary pad layers, the microfluidic channels, the reservoir, and the dissolvable membrane. These 4 aspects come together to create a device that offers transport, control, and diagnosis. This is a video of our final prototype collecting 1 milliliter of blood analog fluid. As the pad absorbs the fluid, it moves down the microfluidic channels and collects above the reservoir. Eventually, you see the fluid break through the reservoir and turn the test strip red. If this were blood, this would produce a result of either a positive or negative on the test strip, made visible by the viewing window. The project's first key component is the pad's layer design. The top layer is a porous hydrophobic sheet with slits that directs fluid into the ADL while keeping the top sheet dry to prevent rewetting of the user's skin. Beneath it, the hydrophilic ADL contains silicone microfluidic channels printed on its surface, backed by a hydrophobic layer shaped to match the channels. This setup guides fluid through the channels and prevents leakage into lower layers. At the collection point above the reservoir, the hydrophobic backing is absent to allow fluid to drain into the reservoir. Any remaining fluid is absorbed by the absorbent core, which uses multiple materials to prevent leakage. The next component of our design is the microfluidic channels. They're what create the ability to draw the fluid through the layers of the pad to the diagnostic tool. Through various rounds of testing, we came to the final design. These channels are 3D printed onto the layer using a custom silicone ink created by our sponsor's lab. The reservoir is what houses the lateral flow assay, or LFA. A 100 microliter well directs fluid to the LFA, where fluid is absorbed into the strip and diagnostic test occurs. The reservoir is made of a pliable resin, allowing the reservoir to bend as needed for user comfort. The final component is a PVA dissolvable membrane that sits in the well of the reservoir. These membranes allow fluid to collect in the reservoir over time and create a time release of fluid to the lateral flow assay. This is the first step of many to improve the standard of care in women's health. With continued development, the prototype can reduce the time it takes to diagnose menstrual disorders, because earlier detection doesn't just improve care, it changes lives.